puncture is often a frightening experience for the patient. The medical assistant should take time to explain the procedure to the patient in a hurried and confident manner. This helps relieve the patient's fear, which relaxes the patient's veins, make the venipuncture easier to perform.
Good morning, sir. I am Narindi Caballero, your phlebotomist for today. So please state your name, your age, and your birthday.
Harold Perino, 19, April 7, 2000.
Please spell your last name.
P-R-E-G-R-I-N-O.
Okay. So, any latex sensitivity, sir?
No.
Have you fasting?
Yes, the doctor told me to fast for 12 hours.
Any phobia for the needle?
No.
Okay.
After sanitizing your hands, position your patients. Then, truly palpate the selected vein, gently palpate with the fingertips to determine the direction of the vein and to estimate its size and depth. Cleanse the site with antiseptic wipe. Assemble the equipment, select the proper tube for the task to be performed. Prepare the evacuated tube system and put on gloves. Reapply tourniquet, uncap and inspect needle. Remove the cap from the poster needle using a twisting and pulling motion. Insert the poster needle in the small opening of the plastic holder. Screw the plastic holder on the lunar adapter and tighten it securely. Ask patient to make a fist and insert needle. Establish blood flow, release tourniquet and ask patient to open fist. Establish the vacuum tube setup by firmly grasping the holder between the thumb and the underlying finger to prevent the needle from moving. Allow tubes to fill until the normal vacuum is exhausted and blood ceases to flow. Place the other tube to be drawn in the holder. Use a clockwise twist to engage them with a needle and push them the rest of the way onto the needle until blood is established. When the last ETS tube has been filled, remove it from the holder and mix it before removing the needle from the arm. Carefully withdraw the needle and immediately place a cotton ball. Then discard the plastic holder and attach needle in a biohazard sharps container. Label the tubes with the patient's first and last name, patient's date of birth, time the blood was drawn, and your initials. Check patient's arm and apply bandages. Dispose of contaminated materials. Thank patients, remove gloves, and sanitize hands. Make sure the patient is feeling fine, not dizzy or lightheaded before they stand. The procedure for butterfly method is almost the same as the ETS. Greet the patient and introduce yourself. Identify the patient by asking the patient to state his or her full name and date of birth. It is important to confirm that you have the correct patient to avoid collecting specimen on the wrong patient. Compare this information to the information of the patient chart. If the patient is required to prepare for the test with fasting or medication restriction, determine whether he or she is prepared properly. Then sanitize your hands. Position patients, apply tourniquet, and ask patient to make a fist. Select a vein that has bounce or resilience and can be easily anchored. Wiping the hand with an alcohol sometimes makes the veins more visible. It is easier to select appropriate equipment after the vein has been chosen. Preparing it while the site is drying saves time. Attach the butterfly to an ETS holder. Grab the tubing near the middle end and run your fingers down its length, stretching it slightly to help keep from coiling back up. Position the first tube in the holder now or wait until after the needle entry. According to the OSHA BBP standards, glove must be worn during phlebotomy procedures. The tourniquet aids needle entry. Hold the wing portion of the butterfly between your thumb and index finger, or fold the wings upright and grasp them together. Cradle the tubing and holder in the palm of the dominant hand or lay in the patient's hand. Uncap and inspect the needle for defect and discard it if flowed. Anchoring stretches the skin so the needle enters easily and with less pain, and it keeps the vein from rolling. Insert the needle into the vein at a shallow angle between 10 and 15 degrees. The flash of blood in the tubing indicates vein entry. Blood will not flow until the needle pierces the tube stopper. Place a tube in the holder and push it part way onto the needle with a clockwise twist. Grasp the holder flanges with your middle and index finger, pulling back slightly to keep the holder from pushing, and push the tube onto the needle with your thumb. Releasing the tourniquets allows blood flow to normalize. Place gauze, remove needle, activate safety device, and apply pressure. Maintaining tubing and holder below the site and position so that the tubes fill from the bottom up to prevent reflux. Fill additive tubes until the vacuum is exhausted to ensure the correct blood to additive ratio and mix them immediately upon removal from this holder. A wing blood collection allowed lower angle of insertion, greater control, and easier maneuverability. However, using them in every patient may not be appropriate. Therefore, choose wing collections set only when circumstances require them. Examples include when blood cultures ordered in addition to other laboratory tests, are coupled with syringe or in small or fragile veins where needle placement and control are critical to the success of the puncture. The purpose of capillary puncture is to obtain a blood specimen for patient's diagnosis or monitoring from a finger puncture. The procedure from this capillary puncture is the same as the previous venipuncture steps. Select the puncture or incision site. Warm the site if applicable. Warming makes blood collection easier and faster and reduces the tendency to squeeze the site. Clean and air dry the site. Prepare the equipment. There are two ways to perform capillary puncture: by using normal lancet for capillary tubes or by feather lancet for filling microtainer. Puncture the site and discard the lancet incision device. Wipe away the first blood drop. Fill and mix the tube's container in order of draw. Apply pressure with a clean gauze pad and elevate a site until bleeding stops. Label the specimen and observe special handling instructions. Check the site and apply bandage. Dispose of used and contaminated materials. Thank patients, remove gloves, and sanitize hands. Transport specimen to the lab.